Hi, I'm Larry Downs, CEO of MSNJ, and I'm here with Amanda Shiber, our Chief of Staff. And today we're going to discuss the New Jersey Out-of-Network Consumer Protection, Transparency, Cost Containment, and Accountability Act and the services, particularly the medical services, to which the law applies. And Amanda and I will kind of do this together as we go through, and we're going to just kind of have a little discussion. So the first question that someone needs to determine is whether the law applies to a claim for services.
So the main point of what we're looking at are claims that are provided by a New Jersey licensed physician to a patient with a New Jersey issued health benefits plan through insurance company, HMO, health hospital or medical service corporation, MIWA, the state health benefits program, the school employees health benefits program. It's all New Jersey issued health benefit plans.
So it basically just applies if your patient has insurance, it's likely that the act will apply to the claim if other necessary requirements are met. So we'll go through those now. So again, the first, for an insured patient, the first question is the patient's plan a self-funded plan? One that's self-funded is usually governed by a law called ERISA, or a fully insured plan where the company actually provides the insurance for the patient. And that would be also known as commercial plans.
So a lot of questions that we get are about how to identify whether a plan's self-funded or fully insured. And to do that, currently the law, or before this law in the state of New Jersey, the cards have to say, the patient's insurance identification cards have to say on the back whether the plan is fully insured or self-funded. Now, sometimes plans use the word administered for self-funded. Sometimes they use insured for fully insured. So that was a little bit confusing. Now, with this new law, the Department of Banking and Insurance is requiring that the front of the card say when a plan is self-funded. So the words self-funded in all caps have to be on the front of the cards. So this is when cards are newly issued. They have to now say that on the front. Or if the plan is decided to opt in, it also has to have the words yes on the front. So if they're New Jersey arbitration, yes, self-funded, that means they fall under the law. If it just says self-funded, it just means they're a self-funded plan. They're not under this law.
And many physicians may see a patient in the hospital and not have access to that card before providing services. And if so, you'll need to contact your hospital billing department to get a look at the card for the physician portion of that bill to see whether or not your patient has fallen under the law and whether the services have fallen under the law.
Or just wait till they get the EOB from the insurance company to see whether the law applies.
So we're going to go through a couple of decision trees here. So the first one is the patient's insured and the patient's plan is self-funded. The next question is, has the plan opted in? Because there is an element of the law which allows a self-funded plan to opt in. And as we previously discussed, going forward, the cards will indicate that on the front of the insurance card. If it's no, then the patient can be billed. Likewise, if the patient and or the physician choose to initiate binding arbitration. So here the patient may elect to take the physician to arbitration if they disagree with the amount of the bill. So just because the plan is self-funded and not opted in doesn't mean you're out of the woods in terms of somebody challenging the bill.
And we do have another flow chart that discusses that patient arbitration option.
And if the plan has opted in, then we treat it just as we would a fully insured plan. So let's move to the fully insured side. So if we have a fully insured plan or a plan that's opted in, the question is, were the services provided in a facility? So you can see on our slide the types of facilities. So this does not apply to services applied in a doctor's office, but it has to be a facility-based service.
In New Jersey.
And if not, then only the disclosure portion of the law applies. And this will be a recurring theme through our discussion. It's almost always the case where you should be disclosing network status, your participation status, and your charges for certain services. So if there's no element here which puts the service under the law, you're still obligated to disclose.
And we'll discuss disclosure in another video.
So if they were provided in a facility, we need to kind of analyze, were the out-of-network services on an urgent basis, an emergency basis? Did the patient have a choice in their provider? Those are the kinds of questions. And most all of the time, if the patient is present in the facility and services are provided to that patient, they do not have the choice or the opportunity to elect who they're going to see, chances are that that was going to be classified as inadvertent or emergency.
Right. So under the law, inadvertent basically means when a patient goes to an in-network healthcare facility for a covered service and in-network services are not available. I think lab tests, pathology, radiology, anesthesiology, those types of services where the patient does not have a choice, but they've gone to an in-network healthcare facility for services, those would be considered inadvertent. As far as emergency, it depends on how EMTALA defines emergency. So if those services would be considered an emergency under the federal law of EMTALA, then they likely fall under emergency under this law.
So at this point, we have a fully insured patient. The network, the services, the out-of-network services were provided in a facility, and the patient was the recipient of inadvertent or emergency services. What happens now? The physician should bill the payer directly for the services provided, and at that point, there'll be some decisions that are made.
Well, it really makes the process all between the payer and the physician at that point. The patient's completely taken out of the process.
And the patient will still be responsible for whatever they would have paid had the physician been an in-network physician. So
Right.
co-pays, deductibles, those kinds of things will still be the responsibility of the patient.
So if the services were not inadvertent or they were not emergency, there's a determination of whether the patient knowingly, voluntarily, and specifically chose to receive the care from an out-of-network provider or practice. So this is really your elective procedures where a patient is choosing to get out-of-network care. And those cases, it does not fall under the law. And, you know, the law gets really specific on what knowingly, voluntarily, and specifically means. But it's really about patient choice and the patient choosing. This is something a physician should think about, having a disclosure form or acknowledgement form of getting this type of care.
The other thing we would recommend is if the physician is in a position to obtain a consent form, that it would include this knowingly, voluntarily, and specific language, so that when bills are rendered after the service, it's clear that the patient elected that service. And again, if the patient did, in fact, knowingly, voluntarily, and specifically choose, obviously, you would have disclosed to that patient the costs and the network status of your practice. Again, certainly important to document that and make sure that those disclosures are compliant with the elements of the law. And if no, we need more information to determine whether or not the law applies. So if there's a question about whether the patient knowingly and specifically chose or didn't, then you'd need to reach out to us at the Medical Society and we can kind of do a fact-specific inquiry for you.
So finally, if the services were not provided by a New Jersey licensed physician to a patient with a New Jersey issued health benefits plan in a New Jersey facility, then no, the law would not apply. So if the patient has Medicaid, Medicare, Medicare Advantage coverage, if it's a PIP claim, long-term care, workers' compensation claim, then it really, only the disclosure portion of the law applies. The rest of the law does not apply. And then if they're not covered by any of those plans, or you're just not really sure what kind of plan the patient has, then we just need more information to help you to make that determination. So thank you so much for joining us today. And don't forget to download our guidance, which is available at msnj.org/OON for out of network for more information. Please feel free to contact our Member Resource Center at 609-896-1766 extension 0 for assistance, or email us at info@msnj.org.